Every year, there's an increase of ankyloglossia in the USA.
4 or 5 months after Patrick was born, it was misdiagnosed. There were a lot of symptoms, but we just kept being told that everything was normal.
So at 5 days old, my first daughter just like projectile vomited all over me, and from that day forward, it just continued happening.
Okay.
And I'm like, what the heck? This is just not normal. Everyone's like, maybe spit up. It's normal. I'm like, no, this is not normal.
Let's talk a little about tongue ties.
The common things that are associated with restricted tongue mobility are things like clenching, grinding, neck and shoulder tension. Okay, so if they have those symptoms, those are common symptom individuals who may be compensating for a tongue tie.
So in February, I had a surgery to fix that. And oh my goodness, I never thought I could breathe that well.
I was just gonna ask you, what did you notice in terms of
Yeah.
sleep or anything else after your release? You might remember a little bit more.
I do feel like I slept a little better. I have noticed a difference in mouth breathing though.
Yeah.
It better?
Yeah.
Yeah.
I used to be like,
The overall consensus is that open mouth breathing is less good for sleep quality. It's associated with a higher risk of sleep disorders.
So your tongue, your neck muscles, abdominals goes into your hip flexors, so your psoas muscles, your adductor group, and actually goes down and attaches right to the arch of your foot. So the arch of your foot is connected into the, tongue and palate fascia.
You can think of that as like spider webbing that goes from head to toe. And if it's tense and tight and tethered, then it's going to create tensions throughout the whole entire body. So therefore, compensatory strains throughout life that are unnecessary if it's released early.
It's a stressful event to be born anyway. I always think about this on like a really basic level. I was in a room and it was warm and cozy and I had no clothes on and I was swimming in warm water, and then all of a sudden it was bright and there was temperature regulation, people were loud, like this is making me on fight or flight and I'm an adult. I'm like, that sounds horrible.
Yeah.
Like it's that sounds horrendous. It's really, it's stressful.
My baby did not thrive at all, and I really struggled. And then, he turned 1, and he turned 1 and he still would not drink milk. Then when my mother-in-law came to visit us one day, just out of the blue, she turned around to my husband and she said, your son has a tongue tie. And we were like, what are you talking? First of all, I was like, what the hell is a tongue tie?
When you're mouth breathing at night, you're not getting quality sleep. You're not getting your full, deep REM sleep, so that when you wake up in the morning, you're not fresh. Your brain is tired. And so what does that look like in a child when they get to school is that they are already tired. There's a new lesson being taught in chemistry and they're fried, so they can't take it in. You think if you look at the brain and you think the brain is filling up as a cup of water and it's right here, and then you were trying to give you more information and it just runs over. And what happens is the child will just deflect, sometimes back down into primitive brain even, and they're just like going la 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 la, thinking about the birds and that are tweeting outside or what they're gonna do after school. And the teacher takes this as a child who is not intelligent or not attentive. Maybe they need to go see have a neuropsych eval for ADD or ADHD because they're not, but it's really not that. It's that they're not getting quality sleep and they haven't gotten quality sleep for years and they're unable to organize themselves to take in that higher learning.
Here in patient 1, you can see the physical difference between the airway widths from this before image and this after image. In this next image, notice that the volume increased from 13.2 to 16.8 and the minimum area increased from 137 to 159.
Okay, so the first thing I want to ask you about, we're a pediatrician for 30 plus years. Can you talk a little bit about, some of the concepts like, fascia and chiropractic and nervous system, and how do those concepts kind of change over the course of your career, and like those ideas, was it a something that was talked about? Was it something that you didn't talk about?
Speaking to fascia, nobody understands where those meridians are.
It's not in the basic training of even the dentists that are performing the releases or most of the medical community about how structure plays into that.
And I just want to ask you, she says she's seen a huge rise in ties. Do you have any kind of like where's their ideas on that in terms of,
Yeah,
why is it happening?
for sure, for sure. So number one, I think that there's been less treatment of infant tongue ties in the past. And so now we're seeing the fallout from that from, 15, 20, 40 years ago. And number two, I think that there's greater awareness now, which is a good thing, of how these ties are affecting different individuals. And I think that the chiropractors are now starting to look for it. And the more that you look for it, the more you start to see it. So I think that it's great that that these chiropractors are seeing these problems more. I have some colleagues who are actually doing research in head neck cancer patients, and they're seeing that a lot of head neck cancer patients have tongue ties and sleep apnea. And so when you have tongue tie, it causes clenching, grinding. You might bite on your tongue. You might have open mouth breathing, inflammation, and it's no wonder that now that we understand how to assess for tongue ties, we're seeing them in a host of downstream conditions and fields.
Yeah, I think for me the most surprising thing was to see how truly quality of life, breathing and airway can be so affected by the coming together of fascia in your tongue and teeth and TMJ and your bite. So I just had this really new understanding of how the fascia is a full body suit, and that for me was the biggest aha.
So I'd say overall this documentary is just a guiding light for parents who are struggling through these issues with their infants, whether it be for breathing, for feeding. A lot of people aren't aware about this topic, just as I wasn't before, which is why I'd say the point of this documentary is to educate the audience, whether it be guardians or just people who should know.
And then what were your top learnings? Anything that, changed your life?
I think that understanding the complexity of this and all the different aspects of this, even having gone through it myself, I don't think I really realized, the scale of these things and how many people, are facing some of these difficulties. So I think that was a big shock for me.
Our bodies are so intelligent that mild tongue ties, subtle narrowness in our palate, tension in the fascia, subpar balance of the parasympathetic and sympathetic nervous system, and difficulty nursing or chewing, or even lack of quality sleep are all independently inconsequential factors, better known as IIFs, that on their own may be considered insignificant. What about the relationship between shortness of breath and IIFs? What if we were living a life, running out of breath, and didn't have to?